Have you ever heard someone say they died of a broken heart? It sounds like something out of a dramatic movie, but what if I told you it's a real medical condition? It's called Takotsubo Cardiomyopathy, or more commonly, broken heart syndrome. And today, we're going to dive deep into what it is, how it happens, and why it's so important to understand. First, let's do a quick heart anatomy refresh. Your heart has 4 chambers. The 2 lower chambers are the ventricles, and the main pumping chamber is the left ventricle. It's the powerhouse that pushes oxygen-rich blood to the rest of your body. Now, imagine this powerful muscle suddenly changing shape, becoming weak and inefficient. That's exactly what happens in broken heart syndrome. The name Takotsubo comes from Japan. It's the name for an octopus trap, which has a round bottom and a narrow neck. When a person experiences this syndrome, their left ventricle balloons out at the bottom while the neck remains narrow, making it look just like one of these traps. This change dramatically weakens the heart muscle, so it can't pump blood effectively. So, what causes this sudden, dramatic change? The most common trigger is intense emotional or physical stress. Think about the sudden loss of a loved one, a major financial crisis, a terrifying accident, or even a surprise party that's just a little too surprising. The body's response to this extreme stress is to release a massive surge of hormones, like adrenaline. It's part of our fight or flight response, which is normally a good thing in short bursts. But in broken heart syndrome, this flood of stress hormones is so overwhelming that it stuns the heart muscle. It's like an electrical overload that temporarily paralyzes parts of the heart. The physiological effects can be immediate and scary. People experiencing Takotsubo often have symptoms that are nearly identical to a heart attack: sudden, intense chest pain, shortness of breath, and sometimes even fainting. This is because the stunned heart is struggling to do its job, leading to a backup of fluid in the lungs and a drop in blood pressure. The ECG readings and initial blood tests can also look just like a heart attack, which makes diagnosis a real challenge for doctors in the emergency room. So, how do doctors tell the difference? The key diagnostic tool is an angiogram. In a classic heart attack, an angiogram would show a blockage in one of the coronary arteries, cutting off blood supply to the heart muscle. But in broken heart syndrome, the arteries are typically clear. There are no blockages. Instead, when doctors inject dye and take an X-ray, they see that characteristic ballooning shape of the left ventricle, the Takotsubo shape. This is the moment they know it's not a standard heart attack. Interestingly, this condition affects a very specific group of people. Over 90% of reported cases are in women, particularly post-menopausal women between the ages of 50 and 75. Scientists are still trying to figure out exactly why this is. Some theories suggest that hormonal changes after menopause, specifically the drop in estrogen, might make the heart more vulnerable to the effects of stress hormones. It's a fascinating area of ongoing research. Now for some good news. Despite how terrifying it sounds, the prognosis for most people with broken heart syndrome is actually quite good. Unlike a heart attack, the damage to the heart muscle is usually not permanent. With proper medical care, the heart's shape and function typically return to normal within a few weeks to a couple of months. Treatment usually involves medications to support the heart while it recovers, like beta blockers or ACE inhibitors, which help reduce the workload on the heart and manage blood pressure. However, it's crucial to take this condition seriously. In the acute phase, it can lead to severe complications like heart failure or life-threatening arrhythmias. That's why immediate medical attention is so important if you ever experience symptoms like sudden chest pain. Never, ever dismiss it as just stress. Let a doctor figure it out. Understanding broken heart syndrome is about more than just medical curiosity. It's a powerful reminder of the profound connection between our minds and our bodies. Our emotional health has a direct and physical impact on our heart. This highlights the importance of managing stress and seeking support during difficult times. Whether it's through therapy, mindfulness, exercise, or connecting with friends and family, taking care of your emotional well-being is a vital part of taking care of your heart. If you or someone you know is struggling with overwhelming stress or grief, please know that help is available. Talking to a mental health professional can provide you with tools and strategies to navigate these challenges. We'll leave some links to mental health resources in the description below. We hope this video has helped you understand the fascinating and complex reality of broken heart syndrome. It's a real condition, with real symptoms, but also with a real path to recovery. If you found this video informative and want to learn more about the amazing human body and how to take care of it, make sure to hit that subscribe button and turn on notifications. We have so much more to explore together. Thanks for watching, and we'll see you in the next one.